Hello, good evening, everyone. We are live from Boston. It's a little after 7 p.m. It's great to be with you tonight for our second virtual town hall this year in 2025. I am joined tonight by Justine de Jaegher, who's one of our IOCDF advocates. She's also a former member of the Faith and OCD SIG and the LGBTIQA plus SIG and chair of the Canada Task Force. She's also a new member of IOCDF's new Public Policy Advisory Council, and we'll be sharing a bit more about that tonight. And by background, Justine can share more about this. Also has a pretty extensive background in public policy and advocacy herself through her career in graduate school and in her degree in public policy and administration. So Justine, thank you so much for being with me tonight here.
Yes, thanks for having me. Excited to be here.
Great. So tonight we're going to be talking more about IOCDF strategy. Folks might recall way back in February, we had a town hall talking about the strategic plan that just launched this year. And we want to dig into some of the specifics and the things that we're working on, and also just give you some updates on some of the exciting work we're doing. And so this evening, we're going to be focusing on public policy, and we'll have lots to share. Before I do that, I just want to share a few quick updates about some great things that are going on. First, I want to call your attention to, if you haven't seen it yet, yesterday we launched a new webpage on our iocdf.org website that lays out a journey map for treatment for OCD, and it's called our treatment guidelines page. It lays out in very good detail for a general audience all the different treatment options, from frontline treatment to additive treatments, second line treatments, and beyond. Folks worked very hard on this for several years from our community, our scientific and clinical community, and a number of people on the staff. So please do check that out and feel free to share it as broadly as you can, as you want to. I also want to call a couple quick things. One is that just on Saturday last week, we held our BDD, Body Dysmorphic Disorder online conference, the second one. Our first one was last year in the spring. We had over 400 attendees. It went very well, and we've gotten great reviews so far. This year, we did that conference in partnership with one other organization in the world that we're aware of that focuses on BDD, called the BDD Foundation, that's based in the UK. So that was an exciting opportunity for us to partner with someone internationally, touch on a broader audience, and we did some really cool collaborations on that. So thank you to all the folks who helped serve and give talks on that conference this past weekend, and of course to the staff who always do a fantastic job with all of our conferences. And speaking about the conference, you probably know the annual OCD conference in Chicago is coming along in just a few weeks. It will be held from July 10th through July 13th. If you haven't registered yet, please do that. We're on track to get close to 3,000 attendees this year, which we're very excited about. And you may have seen, but in case you haven't, in addition to the traditional programming that we have, we've added new tracks, extra talks in areas like on BDD and hoarding. We have new tracks for prescribers to try to attract more physicians and other types of clinicians. And we're also going almost completely hybrid this year as well. So with a couple of exceptions, almost all the programming will be available online. So if you're unable to travel to Chicago, I hope you consider signing up for that. And as always, you've got the link below. Please do check that out. And our early bird rates are expiring soon. So if you want to get those discounted deals, please go on and do that soon. And hope to see you all in Chicago. Just want to mention two other quick things. One is that walk season has started. We held our Boston walk just a couple of weeks ago. It was really well attended. We had over 800 walkers again this year, far and away last year and this year more than we've ever had before in the past, and raised altogether so far with our walks almost $90,000. And we've got 32 walks planned so far for the rest of the year. We expect to have close to 50 walks. So that program's really growing. We're going to have an international walk again this year during OCD Awareness Week. And can't wait to see how many more walkers and participants we get this year. It's such a wonderful way to get out there and be with so many people in the community and just start spreading awareness. So just a few updates and some exciting things going on. There's always a lot. And so Justine, before I jump in, I was just going to talk a little bit about strategy. And before we do that, I thought it might just be helpful, if you're comfortable with it, maybe just talking a little bit about public policy and what are you excited to talk about tonight?
Yeah, absolutely. I mean, I'm excited. I think it's an important area. And not everyone always associates policy advocacy with OCD advocacy, but it is crucial, right? In terms of accessing to accessing basic health care, medications, access to evidence-based treatments, research grants, which we'll talk a lot about. There's a ton there that can impact access to OCD treatment, and that can be influenced by the IOCDF and by our advocates on the ground. And so very excited to keep moving that forward. And of course, at all levels of government, right? We'll talk a bit about national and state, and then of course there's international work happening as well. So very excited about all of that.
Yeah, great, thanks. So just 2 minutes, so some of you have heard us talk about our strategy and our strategic plan in the past. And Rachel, behind the scenes, if you don't mind sharing that first graphic really quickly. A strategic plan is basically a way to help us have an approach and a plan with really ambitious goals to help advance our mission and our vision, which we have up here. It's the kind of thing you can never say it enough. It's just really important that we center around what we're trying to accomplish and why we exist in the first place. And everything we do around the strategy and changes we may make and new programs, everything is in service of our mission and this community. So it's incredibly important that we're always coming back to that. It's always home base is what is our mission and what are we trying to accomplish through our vision. Next slide, Rachel. So I hope everyone on this live stream tonight has seen this before, but just in case you haven't, this graphic kind of lays out at a high level what is included in our strategy, and you can learn more on a website called Vision 2030, and we can throw that link up as well. So there's 3 aspects and goals that we have within the plan, which is increasing awareness in community, expanding access to effective treatment, and advancing research. And part of the parts in the plan to advance us making progress on those 3 things are these 3 circles interlocked around, which we call the 3 Ps. It's policy, partnerships, and pediatrics, which also means kids and families. And over the next few months, we want to dig into each of those 3 Ps. These are the areas where we're taking a different approach. We're doing things that are somewhat different than what IOCDF has done in the past. And I think it has the most potential to really unlock and help us get closer to what our vision is. Thanks, Rachel. So we'll talk about public policy tonight. Justine, I know, has a bunch of questions. We would love to hear from folks in the audience too with questions that might be on your mind. And I'll just give a really quick update on what we've done so far. One is with the launching of the plan in January, obviously, at least in the US, it's a very dynamic time in politics and especially at the federal government level. So really hit the ground running. A couple of things. One is that we worked hard last fall and then into the winter to establish a new public policy advisory council. So we have a number of people, including Justine, who either have OCD themselves or have a family connection to OCD or otherwise, who are professionals and have experience doing public policy work, whether it's through a policy lens like Justine or through lobbying or other types of professional work. So we actually have a pretty high-powered, effective group with lots and lots of years of experience on navigating politics and helping stand up the ways that we do advocacy. So that's one. 2 is that we've spent a lot of time getting clear on that, a nonprofit like IOCDF, we're non-political. We're not allowed to make political statements or be partisan, but we can do advocacy in terms of education, and helping emphasize and share with decision makers what are the issues that are most important to the OCD community, whether we're in favor of them, not in favor of them, have suggestions on how to make policies better, how to make legislation better. And there's lots and lots of opportunities that we'll get into on how public policy really can impact in a good way on our community. In March, I went down to Washington, D.C. and met with a number of members of Congress from states from all over the U.S. And one of the members of our council, Lee Godown, was joining me. And it was really well received. We met a lot of interesting leaders. People were very interested to learn more about OCD. Many of them had not really heard of OCD before or understood it very well, and also hadn't heard of IOCDF before. So it was a great opportunity to introduce them to us and what we do and what our mission is, and then talk about some of those issues that are so important to us. That week I was there, both the House and the Senate were in session, and there were thousands and thousands of people in DC advocating and engaging with their leaders. And that was really good to see. It was exciting to be there. And I think it's important that we showed up to our community and me on your behalf to talk about our issues and what's important to us and make sure our voices were also heard. And we hope to do more of that this year and, of course, in future years. And in addition to that, I'll mention two other quick things. One is that we are also in the process of working on our first ever policy white paper that we hope to be able to share later this year in the fall. And I can talk more about that if there are questions, but it's really going to be important to help us establish ourselves as a voice to represent the OCD community and to have information that's based on research that we can share with leaders to help them really understand the importance of the work that we do, the very, very significant treatment gap there exists for people with OCD in the US, and no doubt that that's true in all the other countries in the world as well. And I think it's just a starting out point. We hope to publish many of them. So more to come on that. And then the only other thing I'll mention is that we're doing mostly work at the federal level so far in the first 6 months of the year, but we do hope to expand that at first in the US and think about how we can get involved at the state level and also help empower everyone in our community to talk to their local leaders and also empower folks internationally to advocate within their own countries and their own communities too. So I'm going to take a deep breath, and Justine, I'd love to get your thoughts on how we're doing so far and any questions you might have on your mind.
Very exciting. Yeah, I mean, it's been really exciting to see the work happening so quickly over the last few months since the release of the plan. And yeah, I guess I do encourage folks in the chat to submit your questions as we go. We'll keep an eye on it. I do have many questions, though they diminish in quality. Towards the end, I just asked Becky to describe how a bill becomes a law, and I don't think we need to be doing that. So yeah, please do share those. We'll take a look. But I do have many of my own. I guess, first off, it is one of the 3 Ps in the Vision 2030 document, which is exciting. I guess, how did that come to be? What were some of the discussions? Like why policy is a priority area? And how was that identified?
Great question. So people may remember we had a number of listening sessions a little over a year ago now in May of 2024. And one of the many themes that we heard from, I hope all of you who participated, those and beyond, was still a real lack of awareness about OCD. And even when I was interviewing for this role with our board of directors, it came up as well. Like, why isn't OCD as successful with getting funding for things or awareness like other mental health disorders like schizophrenia or autism? And then I also learned in the course of being here in the role last year that our research dollars for OCD, federally funded research, which I'm sure we will be coming back to as a topic, we get about 10 times less funding, about $25 million a year from the federal government compared to a lot of other mental health disorders with a similar or less prevalence rate. So just again, put that in context. OCD research gets about 25 million, other disorders get 250 million plus. So those two things came into sight, into my lens. And talking about it, I think a lot of that is because of a not really focusing on advocacy and not necessarily always engaging with government decision makers. And IOCDF is an amazing organization. We do a lot of advocacy, particularly around raising awareness and people with lived experience sharing their stories, which is incredibly important. We haven't necessarily carried that forward and really engaged with people who make decisions about how research gets funded and what the funding goes to, decisions around access to care and insurance, decisions around how trainees are required to receive information, and on and on. So that was real reason. And I believe that doing this public policy engagement will be totally transformative for us. Even in the limited time, it's been 6 months. I think the traction that we're getting with governmental leaders, the interest just from the community, the buzz we get when we post things on social, launching or relaunching our Policy Action Alert Center, have all been like really positive things. There's always going to be important issues. There's always going to be things that are important, could really affect the way people get their treatment for OCD or even know that there are treatment options for OCD. And I think those are some of the reasons why I think it will be very important. And I also think it helps us learn, we're starting out focused on, at the US level, I think we're going to learn a lot about dynamics and opportunities in other countries, and hopefully develop toolkits and more guidance for many other people, both in the US and around the world, on how they want to do the same work.
Yeah, fantastic.
Yeah.
I want to touch a bit on, obviously, strong reasons to have policy as a focus. But I do think we know that a lot of folks feel quite cynically about politics and policy as a positive avenue for change. I guess I'm wondering, what you would say to those people and how, I think it's our belief that, of course, we can, working together, move the needle in a positive direction on some of these issues. But what would you say to folks who feel pretty cynical about policy?
Yeah, I think it's a totally fair question. And regardless of what year it is or what's going on, I think a lot of people have a lot of cynicism about politics. I should share that I worked in government for a number of years earlier in my career. I've been on the other side of things, and I know there are actually a lot of very committed, caring, smart, thoughtful people who work in government that want to help make people's lives better and help people thrive. And knowing that, I think in spite of what may be going on today in the US and in a lot of other countries as well, we have to have hope. We have to believe that there's a lot of people, more people there who want to do good than do not. And first and foremost, any decision maker, when they hear from people that they represent, even if they don't want to, but if they hear personal stories from people like you, Justine, who have OCD, they understand the journey that you've been on, the challenges that you faced, the fact that there's so many effective treatment options available for people today, but so few people access them and know that that's available to them. There's so few clinicians who are trained to do ERP and other effective treatments. It's hard not for them to listen to that. Nothing gets through that more than a personal story. And that gives me a lot of hope. In the 18 months that I've been here, people like you, so many people who are on this live stream right now and who will watch later, have amazing, compelling stories that they are so willing and brave to share with others. And it knocks me down every week, how much people overcome, how much they're contributing back to their community. And it gives me so much hope because I know those stories are going to have a really positive effect on people in a position to make decisions. The other thing, too, is while language changes and tactics change, politics actually has been kind of a rowdy thing and a hard nut to crack forever, right? Since like probably Roman times and maybe even beyond that. It's supposed to be based on, different points of view, trying to reach consensus, trying to negotiate and come out to outcomes that folks can agree upon. And again, government is supposed to be focused on helping others. And I don't want to sound overly optimistic. I know there's real challenges right now and a lot of things under threat. And we take those really seriously, and we can talk more about that. But you have to show up. You have to share your stories, and you have to believe that by doing that, we can start to move the needle.
Well said. Yeah. fully agree.
Yeah.
And yeah, I mean, I'll just add, policy advocacy is hard. It's not easy, but if there's a community that I know can do hard things and commits to doing hard things all the time, it is this one. And so, it doesn't make it not worth doing. There was someone in the chat who mentioned the current political atmosphere, and I think, let's talk about it, at least some elements. I'm hoping we could do a bit of a dive on some of them. Yes, there, Phyllis, thank you.
Yeah.
I guess, I mean, there's a couple things to talk about. I wanted to touch on maybe first, I mentioned it earlier, but the cuts to research grants. So the National Institutes for Health grants specifically, and how those might and are impacting OCD research. If you could expand a bit on that.
Yeah, thank you, Phyllis. It is a very, very concerning situation, even just around the research, and it's not just potential cuts to the NIH. There are a lot of other agencies that fund research that have either been curtailed or paused. And in addition to that, I think there's a lot of questions coming to bear about the federal government's relationship with universities that have had longstanding contracts focused on research and otherwise. So there's a lot going on. I actually have a listening session tomorrow evening with our scientific and clinical advisory board to get even more of a sense of what specific impacts could happen should some of these cuts and things go through. But just knowing what we know so far, I mean, if all this come to be, it will not be good for OCD research in the US. I wouldn't say it would completely stop, but it would be significantly slowed down and cut back. Research will continue in other parts of the world, but it will be a very, very big setback. And it's really, I'd say, at the top of our list right now on things that, at least from a policy perspective, that I really worry about. We've talked a lot about what's IOCDF's role in this, and of course, talking about how devastating these cuts would be for OCD research and mental health research in general. And I think beyond that too, it's just the impact it could have on the future of research in the US for a number of years. We have been talking a lot and thinking a lot about, well, could we try to raise more money and do more research grants, which we certainly could do. We do about under $1 million a year now. So to get even to the $25 million level would be a pretty heavy lift and not something we could do even in the next couple of years. But to really get to that $200 million, $250 million level, it just might not be possible for one nonprofit to do that. And about 98% of mental health research is funded through, in the US anyway, is funded through the federal government. So OCD isn't alone in that respect. I'll just come back to it though, Phyllis, the conversations I had with members of Congress at the time, this was a few months ago, but they were incredibly concerned and not in support of these major cuts to research. How people end up voting and how the budget turns out, we'll see. But it is important for us to all share our voices and communicate with our leaders in Congress, especially while this budget process is starting to heat up and move forward again. They need to hear from as many people as possible what would happen should those cuts go through. And it is a tough environment. There's a lot going on. There's a lot of things swirling. It's hard to keep track of what's in the news and what may be of interest or important to us to know about from the OCD lens. But we have to try. We have to do it. I joke sometimes, like, of course, we launched our public policy initiatives in 2025 when things feel kind of extra. But I think, in a way, it's the best time, because I think it couldn't be, there aren't any, it's as clear as it can be to me that these issues are so important. And this is really the time to be weighing in. So I'm glad I'm in a position to do it.
Yeah. Thank you. Related question, but one we hear a lot right now. In terms of the IOCDF itself, as a charitable nonprofit, we've also seen some cuts to federal grants to the charitable sector as well. But if you could speak a bit to the IOCDF's financial situation and independence, relative independence from those.
Yeah, so that's a great question, and it comes up a lot, so I'm glad to address it. So at the moment, the IOCDF doesn't have any federal or any governmental funding, actually. And so if you had asked me this in December, if I thought that was a good thing or a bad thing, I would say that's something I'd like to work on, and I would still like to work on that in the future. I think there could be opportunities for us to receive federal funding for some of the work that we do. But because we don't, we are very stable. We're not reliant on what happens. Now, that doesn't mean with all the other changes and things that could happen, it won't have other types of effects necessarily, and it would certainly affect our community either way. But financially, we're strong, we're stable. Our fundraising year over year, the past few years, is increasing, and we're on track to break our records again this year for the end of the year. I think some of the potential threats on research is really activating a lot of donors to contribute more money towards research, and they're asking more questions about what our plans are. Donors are excited that we're doing advocacy work and want to know more about that. They're excited that we're doing the white paper this year. So I think it's really activating people around wanting to make sure that we are strong and that we can continue our work on behalf of all of you.
Yeah, fantastic. Thanks for that. I guess we'll turn to perhaps the other maybe policy elephant in the room, and we'll shift to more positive topics soon, but important to address. There is, of course, a bill that has passed Congress. It's now before Senate, which, among many other things, would include some rollbacks on Medicare and Medicaid, and we imagine that will impact our community as well. I was wondering if you could speak a bit to that.
Yeah, thanks for bringing that up. So based on what we've learned, and I think could talk about this later too, but IOCDF is and has been for a number of years a member of a number of coalitions in the mental health nonprofit space. Steph Kogan, who many of you know, our policy director, has also helped lead a lot of our public policy efforts for many years. And we've gone to a number of sessions to understand and learn more about Medicaid cuts and proposed cuts. So while it's unclear what's actually going to happen, restrictions and scaling back of Medicaid benefits especially will really hinder people's ability to get access to treatment in a situation where it's already incredibly hard for people to find therapists who are trained to treat OCD. Many people already are having to pay out of pocket because they don't have health insurance and might not qualify for Medicaid. So restricting access through Medicaid too is really going to be have probably a pretty negative impact for those folks. Yeah. So we're keeping a close eye on it. We have done advocacy on that topic. It is on the list of things that I spoke about with members. And again, for what it's worth, at least back in March, I do know many members of Congress, whatever party they're affiliated with, are extremely concerned about this. But we'll have to continue to keep an eye on it and see what happens with that particular bill that's now in the Senate. So,
yeah. Okay. Thanks very much. You mentioned coalitions, so let's maybe get into that a bit. Sure. I guess first off, why coalition work? Why do you think it's helpful in this political landscape right now? And yeah, just maybe some examples of some of the work we're engaged in coalition spaces.
Yeah, so coalitions, I think folks know, is typically, at least for our purposes, it's a number of nonprofits coming together on specific topics or a menu of topics where we work together to advocate for certain things. So one of the biggest one we're a part of is the Mental Health Liaison Group. I forget how many organizations are part of it. I think it's close to 100 organizations in the US are members. So we will work together and sign on to and develop letters on a number of topics, including potential cuts to Medicaid, including potential cuts to research and other things. The theory is similar to when we'll talk about next time about partnerships. We're stronger in numbers, right? The IOCDF is relatively small. I think we're small and mighty, and we got a lot of pizzazz and a lot of moxie, but we can't go it alone. We need these partners and we need these coalitions to really help amplify the topics that are most important to us. A couple of the other coalitions that we're part of, one's the American Brain Coalition. That's a newer partner with us and a coalition. They're fantastic. They're based in Minnesota. I think I saw a note about Minnesota on the comments briefly. They're located right outside of Minneapolis, and we've had awesome conversations with them. We're also members of a coalition called Cure Brain Disease. That's a newer nonprofit, and they tackle both many types of brain issues, including mental health disorders. And I hope we can join more.
Yeah, amazing work.
Yep.
Okay, so you've talked a bit about the IOCDF's approach to public policy advocacy. So, you mentioned meeting with decision makers in DC. You mentioned the Action Center a little bit. So, yeah, I guess I was wondering if you want to talk a bit more about the overall kind of strategy and tactics we might be implementing, both centrally through the IOCDF, but also perhaps through our network of advocates. What you think about that in terms of strategy here.
Yeah, absolutely. So when you're starting to build these capabilities to do advocacy, it will take several years to build up to the types of things that we'd like to be doing. But what we're doing this year is first and foremost trying to start to build relationships at all levels of government. So again, I said about politics, it's always been kind of rowdy, and it's also hard to understand, but also not hard to understand. It's very relationship based. We like to believe that education and facts and research support positions, and often they do inform policy decisions. But also wanting to help the people that you like also influences policy decisions. And that's just the way it is. It's the way it's always been. And to date, we haven't really focused on building relationships like that, both elected officials, leaders of agencies. And I think some folks do get engaged at their state levels or in their local communities. So we'll be focusing a lot on, at least at the federal level, starting to build relationships. And like I like to say, just getting on the radar, letting them know more about OCD, that IOCDF exists, what our major challenges are. And over time, we'll continue to educate those folks and look for champions. I mean, what you really want to find are key leaders who, whether they have a connection directly to OCD or not, want to be our champion, want to help us advance the issues that are most important for us. The other thing we want to work on, I mentioned the white paper. I think that's going to be really essential. That first white paper is going to focus on a deeper research study than's been done in the past to ask the question, how many adults in the US are currently getting effective treatment for OCD? We know anecdotally and based on smaller studies that number is very small based on what the prevalence rate is. But we want to do a kind of deeper study on that and then come forward with some recommendations on what policy changes or other types of changes would be helpful. And again, I think we know what some of those are, strategies based on that assumption that we want to increase the number of people getting treated for OCD with effective treatment, evidence-based treatment. Later, the second half of the year, which I guess we're basically at now in June, we want to start to work with, through our affiliates, our advocate program, and others to develop a toolkit that anyone can use to engage with leaders at their state government, their local governments, and just have a little bit of a playbook on what are the most effective ways to talk about OCD, the work that we do, again, the importance of sharing personal stories, and again, also in service of trying to build relationships and educate more people about OCD. Like we've talked about for the entire time I've been here and way before that, raising awareness and accurate understanding of what OCD is still so important. It's just every day, every week, we're constantly hearing stories about misunderstandings, misconceptions, and stigma around OCD. So that work is only going to help advance and grow people's understanding. And it's that understanding that I do believe in the long term is going to start to change minds and have people think differently on how to increase access to care and how to increase access to treatment for OCD. So that's our focus for this year. And then in the future years, I'd love to get to a point where we're proposing legislation and getting things passed. I'd love to dig in and do more advocacy work for all of us on behalf, really digging into the many issues that contribute to barriers to accessing mental health care in the US and globally. There are many, many factors that contribute to that. And they're hard. They're all hard issues. I think if they weren't difficult problems, that would be solved already. And again, I think the more voices that are lending themselves to those topics and to those ideas, including the IOCDF, I think that's going to eventually start to move the needle.
Yeah, absolutely. Fantastic. I'm keeping an eye on the chat there. I saw Amy has shared stories about their advocacy in Minnesota, which is very exciting. And you mentioned affiliates. So I was wondering if we could maybe touch a bit on state level advocacy. So you mentioned this toolkit, which, yes, is very exciting. It will hopefully empower those who are, we're seeing in the chat, folks obviously concerned about Medicaid cuts and a variety of issues, hopefully empower those folks to have some skills to share their story, to speak to decision makers. But in terms of other kind of, I guess, what issues do you think we may be able to address at the state level, and what is the role perhaps for our affiliates, state affiliates of the IOCDF?
Yep, great question. I should say before I answer that question, we are going to work on a toolkit, which will be, I hope, helpful, and that will come ideally over the next couple of months. But you don't need to wait for that. Anybody can start engaging with their local leaders right now. All you have to do is be ready and willing to share your story and your journey with OCD, however that is for you. We have a policy action center. I don't know, Rachel, if you already put the URL up, but if you can do it again, thanks. We have issues laid out on the Policy Center now. You can go in, type in your zip code, and it automatically tells you who your representatives are. And we have form letters that you can send, and you can do that right now if you want to on some of those topics. But just coming back to that, so some of the topics that I mentioned, again, around federal level is potential cuts to Medicaid, potential cuts to research, and also there are some policy potential recommendations. It's not bills necessarily related to coming out of Health and Human Services. There have been some commissions set up that are specifically focused on health issues related to kids. And some of the topics that will get focused on there are related to treatment for kids who have mental health disorders and reviewing whether or not it's appropriate for things like SSRIs to be prescribed to kids, which again could be, should that result in policies that would somehow restrict access to SSRIs, could be very, very bad for a number of people and really serious consequences. So nothing like that's happening right now. But as soon as that came up, we clocked it and really weighed in right away to reach out to decision makers that has the potential of having some very negative effects on people. At the state level, it depends, right? So we do track for bills. In January 2025, I searched, obsessive compulsive disorder, intrusive thoughts, like all these keywords for any legislation in any state in the US and at the federal level. And there actually were a few. There were 2 bills in New Jersey that have advanced that are mostly focused on ensuring health insurance coverage for treatment. One was for perinatal anxiety, which is close cousin with perinatal OCD. So we sent a letter to those bill sponsors and voiced our support for that. So I think access and insurance coverage issues, which are really hard to understand and can get complicated, do tend to be regulated at the state level in most states. So that would definitely be one. I think other issues around other topics around raising, I think just educating state leaders about, even if they don't have direct control over it, about still what's going on at the federal level, because anything that's getting cut on the federal level is going to have these trickle down and negative effects possibly at the state level. As an example, if Medicaid gets cut, there are these cascading effects that happen on how states can cover people on Medicaid within their states, and those coverages aren't the same. They vary really widely state to state. I think other issues can be around requiring education, requirements, especially for clinicians and training, what types of certifications they need to have. Those are all things that are generally covered at the state level. So it can get a little wonky, and I want to just kind of reel it in. I don't want to go too far down the rabbit hole. But those are a couple of things. But again, I think even at the state level, or even in your city or town, I think just raising awareness about what OCD is, the fact that there is treatment available and so few people can access it, that's important for people to know, even if they don't necessarily have a direct bill in front of them that could change that. I think eventually it will, and they may be in a position one day when they could make a difference on that topic, and they will have had those relationships and heard those stories and carry it with them.
Yeah, yeah, absolutely. And thank you for highlighting the ability to act on these things more urgently. Because, yeah, you're right.
Don't need to be an expert.
That's
And
right.
in fact, I think most government people would rather not hear from experts, and they want to hear from real people with real issues and talk who they represent. So
that's right. Yeah, I mean, I think a lot of people oftentimes feel intimidated maybe to talk to their elected leadership, but I mean, I would remind you that, they work for you at the end of the day, or they should, and your family members and your community members. And, the more you're willing and able to kind of share your story with those decision makers and with those family members, community members, right? Change those hearts and minds, one person at a time. That does make a difference. So definitely encourage folks to do that. Yes. So, I mean, building off of that, I guess, for folks who, feel really passionately about these issues, who want to make a difference, and feel a bit unsure how to do that or whether they're able, I guess we've touched on it a bit, but if you have any more kind of guidance, or if we have any kind of specific calls to action for folks, what would you recommend?
Sure, absolutely. So coming up this week, our young adult special interest group is going to be doing a push of their own with a letter that they wrote themselves, and I gave very little feedback on it. That's going to be posted through our Action Policy Alert Center, and they're going to really focus on sharing their stories about young adults with OCD and the importance of research specifically, and how cuts to research could really help limit our ability to understand more about this disorder, and are there even better treatments out there that we just don't know yet. I think, again, like I've said a few times, sharing your story is the most important thing. I think, especially helping people understand, for those of you with lived experience, or if you're a family member or whatever, what the level of distress OCD can cause for people, some of the challenges that people feel to even talk about what they're experiencing, let alone feeling that they can talk about it with family members and seek treatment, even try to seek diagnosis. I think it benefits the OCD community, but just generally, I think it always amazes me how few people understand those challenges that I think we understand very well face so many people with all mental health disorders, or many mental health disorders, including OCD, that if they're not faced with it directly, they don't necessarily understand how it seems so simple to say, like, oh, well, if you're having an issue, go to your doctor and get a diagnosis and get treatment. And it just doesn't materialize that way for millions and millions of people. So that's one. I think that's the most important thing. I think the other thing I'd recommend is, if you're not sure, reach out and ask us. We are getting more and more conversant on what the issues are, who our champions are, things to pay attention to. If someone has an idea and they want to do more around advocacy in this area, more than happy to talk with you about that and help supply information. I think the other thing I just say is, like, the most important thing is just be yourself, be authentic, share your story. That's what matters most to people. And the policies, and can get really complex and wonky. Like, those are important to understand for some, but not everyone needs to know all the details and all the facts. A congressman's not going to expect you to know every detail of every bill and be able to answer questions that are outside of your area of expertise. The most important thing is they understand the impact a policy decision could have on you as an individual and on the community at large.
Absolutely.
And what do you think, Justine? Do you have anything you'd add to that? What you think people should keep in mind?
Yeah, I mean, I do think it's this thing of, again, it's this feeling of almost intimidation that I hear a lot, and I felt it too when I was first, reaching out to my local representative. But yeah, it's like, you don't have to be the policy expert. If some of you are, that's great. But yeah, they want to hear from real people. They want to hear from voters who, have concerns, I think, by and large. And it would be far more powerful to hear from folks who are just, you don't need to know the ins and outs of the Medicaid or Medicare programs. You need to know what the impact will be on you or your loved ones if they're cut, right? That's what they need to hear about. And so that's something that you should feel, I think, empowered to do. And we spoke about strength in numbers earlier, about coalition work. There's often strength in numbers too around kind of, reaching out to your representatives, and, you can encourage a few friends, right? If you have concerns about a particular piece of legislation, what if we all call our senator and say, we're concerned about this and this is why, right? So you can find some solidarity there. I think there's a lot of people right now who are craving, who have the desire to do something, right? And every little bit counts and every little bit matters. And so find your people and do the work that way.
Yeah, I'll just say too, for the most part, people in positions to make decisions, they're regular people too, right? They may know a little bit more about the political system or maybe even specific policy issues, but they are parents, children, family members. I think there's very few people who don't have some family connection to a mental health disorder anywhere. And like I said, I think just like being real and authentic with them can go a long way. And it just, feel comfortable talking about what you know and what's.
Yeah, absolutely. Okay, so any other questions in the chat or from anyone participating? We might start wrapping up.
Oh, Phyllis has another interesting question.
Yeah.
It's a really good one. So they absolutely do. I mean, I can't speak for like every congressman elected. I think it's totally true. I think people who are contributors to campaigns can get the ear of the person that they're donating to. But for the most part, even if it doesn't seem like it outwardly, most people who are elected to office at least ran for the purpose of trying to help people and change lives and want to do good by others. So, and the staff that works for them, they're very dedicated. They make really low wages and work incredibly hard, probably like 10, 12-hour days every day to help make sure they're responding to constituents and getting back to people. So there's always bad actors, but I think for the most part, my experience has always been that the majority of people do care and they do want to help.
Yeah. And they will care if enough, voters make the issue an issue also, right? So the more you're sharing your story, engaging with media as well is helpful for this, right? So even if you feel like you're not breaking through with your local representative, though I agree, the vast majority are trying to do good for their community and their constituents, there are pressure tactics, I think, available. And that's largely just, again, getting at those hearts and minds. And that can be done through media, through one-on-one conversations. So that's all really important stuff.
Mm-hmm.
Yeah. Okay.
Folks have any other questions or you, Justine, anything else on your mind, or just putting your hat on as a member of this community? Anything you think is important to share?
Yeah. I mean, I think I'm just so happy to be part of this work. I'm so excited that this has been identified as a priority. I think about my early days of OCD treatment and, obviously very difficult in a variety of ways, but I do think about all the kind of policy areas that impacted my journey, right? My OCD journey, and I'm sure everyone else's, that we don't always think about, but that are so important, right? When I ended up in the ER in terms of accessing that treatment, the training of the professionals there, the staffing of that hospital, and then when I saw my my clinician down the road, my insurance provider and coverage, right? Like all of that stuff, did help in my recovery, and it's all policy. And so I think this really does matter, and working together. I do think we need to keep up the hope that we can shift things, we can move the needle on this. If enough people in your lives, recognize the impact that this disorder has and the impacts that policy decisions can have on people's access to treatment, to quality research, I like to think that they'll make some noise and hopefully get some things changed. So I guess despair not, organize, and we can get some good things going.
Yeah, I couldn't agree more. Thanks for sharing all that, especially about your own experiences, Justine. And I think Amy's saying it well. We are stronger together, standing up with each other, educating people, raising awareness. It's slow, very incremental work. It can take a lot of time to get momentum, but it is possible. I've seen it happen. And I have every reason to believe it can happen for us with OCD too. And in the meantime, like I said, the Action Center is up. It's ready to go. Feel free to use it. If you ever have questions for us, please reach out. Happy to help answer any specific questions that you've got. And we'll continue to keep you all informed about public policy issues and all the other exciting things that we've got going on here at the IOCDF.
Thanks so much, everyone.
Yeah, take care, everyone. Thank you.